Hello and welcome to Inclusive Plug powered by RECONOMY. Across the Western Balkans, public employment services are at the center of labor market transformation. Yet many young people, women, and disadvantaged groups still struggle to access meaningful employment, not because jobs don't exist, but because the system does not always respond to their real barriers. Traditional job matching is often not enough. In this episode, we'll explore how the case management approach is reshaping public employment services, making them more responsive, more human-centered, and more effective. I'm very pleased to welcome Melisa Osmić, Program Officer for the Western Balkans at RECONOMY, working for Helvetas, and Vaida Kamandulienė, an expert from Lithuania with experience in implementing case management within employment services. Welcome to both of you. Melisa, let me start with you. Why is traditional job matching often insufficient, especially for vulnerable young people and disadvantaged job seekers in the Western Balkan region?
When it comes to the Western Balkans and job matching in the public employment services, at least in the majority of Western Balkan countries, I'm going to just try and explain it like in short and simple terms. When you look at the job matching process in the Western Balkans public employment services, you will see that this methodology, let me call it that way, in the job matching process is following a very simple equation. On one side, you have job seekers, including the vulnerable groups. On the other side, you have employers and their vacancies, and then the exchange of information in the middle, where the public employment services by job matching expect that when there is a vacancy and information or mediation, that it will result in the employment. This is, as I said, a simplified way of looking at things. There is one thing that is left out when thinking this way is that the labor markets in the Western Balkan countries are very complex. And they are actually the difficulties that vulnerable groups in the labor market face are, I would say, more structural. They are not informational, but structural. So I'm going to say that for instance, I'm just going to give you some examples of the barriers these young people and other vulnerable groups are facing. For an example, when it comes to young people, they have limited work experience. Accordingly, they do not have any networks, any contacts, and they have difficulties to find their place in the labor market. One interesting thing that I would like to mention here in this context is that a recent employer survey conducted in the Federation of Bosnia and Herzegovina has demonstrated that the employers, out of all categories of vulnerable groups, were most ready and most willing to accept young people. The percentage of employers when talking about elderly workers or women in rural areas, etc., were lower in percentages when it comes to readiness to employ. So despite of their readiness to employ young people, it's still the barriers we are seeing in the labor market for them are still remaining prevalent. Talking about other categories, not to leave them out, I would say also some vulnerable groups also face geographic immobility, talking about women and young people living in rural areas and for various reasons not being able to move for their family situation or similar. Or we have also people who have been unemployed for a long time and then they lose confidence, they do not trust their own abilities. Some of them actually also lack digital skills, soft skills, etc. So these barriers that that we have noticed are not being addressed by this traditional job matching. Let us also not forget the realities of the public employment services themselves. They also have limited capacities when working with vulnerable groups. They do have a large number of cases they are expected to process, and they have also their own constraints. Employers, on the other hand, have trust issues with public employment services and also don't have their own human resources departments in order to deal with these. And all of them somehow expect that the job seekers know what they want, that they know how to articulate their skills, which is actually not the case. And this is what this new approach, a case management approach, I'm saying new because it's fairly new in the Western Balkans, is trying to address.
Thank you, Melisa. And many hear the term case management as you've mentioned it yourself, but may not fully understand what it means in practice. In simple terms, Vaida, what is the core idea behind case management in employment services? Like, how is it different from standard counseling or job referral?
Like you said, many people have heard this term case management, but usually ask what's the meaning behind of it. So my usual answer would be that the case management is a working method, still new in a way, aiming to provide personalized and coordinated support to people who face barriers to employment. Melisa mentioned quite a number of barriers. So case management is about fighting barriers to employment. In public employment services, case management is usually applied to individuals with limited employment opportunities. Let us take some of the examples. People with disabilities, long-term unemployed, or those who are facing social health related challenges. It also might be women who are living in rural areas, or women who are fighting with some, tragedies in their families, and so on and so on. So it's all about the individual who face a lot of barriers, mainly complex barriers to employment. What makes case management different from standard counseling or job referral is that it's not only one-time meeting, not only information about labor market situation, but it's not only about referring to a job. Instead, case management is a structured and ongoing process where the case manager works together closely with the job seeker from registration until employment, sometimes even beyond that. In this process, actually, it's like I said, it's a very structured process, and the process starts with the assessment of the person's situation, identifying strengths, challenges, barriers, and of course, needs. What does the job seeker need in order to get employment, in order to get more employable? So then together, case manager and the job seeker create an individual plan. It should be mutual, of course. Then monitor the progress of the implementation of the plan, also adjust the support if in case it's needed. Case management looks at the person from the overall perspective, not only from the perspective of the job search, but overall. For example, case management may address motivation, like Melisa mentioned earlier before, confidence, social challenges, skills development, and so on and so on. And the overall aim is not only to help someone to find a job, but also to prepare them for sustainable long-term employment after fighting barriers. So again, just the overall idea, it's not just job counseling, it's not just the referral to job, it's a person or individual-centered approach that support a person step by step towards the lasting employment.
Thank you very much, Vaida. Melisa, Helvetas implements RECONOMY with a market systems development lens. So how do you see case management? Is it this simply a service improvement, or does it represent something deeper in terms of institutional reform?
I mean, yes, the case management approach, as also Vaida just recently mentioned, is actually not only the improvement of service and focus on more, let's say, personalized, client-oriented approach. It's also, when you look at it from the perspective of MSD, it's a little bit more deeper. It goes deeper than that. It requires a certain transformative activity. It requires transformation of also, particularly institutions dealing with such categories of job seekers. Now, traditionally in the Western Balkans, the public employment services were engaging in more or less what we call passive labor market measures. That means like vacancy registration, administering benefits, and different things. However, with this new approach, we are trying actually to achieve to change their attitude so that they become more that they engage more in coaching and facilitation, and to build partnerships also to solve problems of the job seekers. So we here are talking about some identity shift from being passive registration and switching from these passive labor market measures to taking a more proactive approach. It actually changes behaviors in the institutions, and I have to say it also requires smaller caseloads for the caseworkers. It also requires new staff competencies that will need to be adopted in order to bring change.
Right.
These are actually systemic changes, not just these tweaks of the whole process where we are saying, okay, we will going to improve this service, but it requires behavioral changes. It also, once there is a behavioral change in the institutions, it will also address the way the public employment services are interacting with the overall labor market situation and labor market developments. They are then more encouraged to cooperate with training institutions, to link job seekers with different institutions, not only to employers or training institutions, but also to, let's say, social services providers. So it's actually a classic market system development thinking where we are trying to achieve deeper changes so that the public employment services become actors and that they have more influence on the system, not only to operate within the system, as was the case so far.
Thank you, Melisa. One of the important distinctions in case management is whether it's conducted only within the employment service or through interinstitutional cooperation involving social services, NGOs, healthcare providers. Vaida, back to you. In your view, why is coordination across institutions so important when supporting vulnerable job seekers?
Yes, that's a great question. Actually, vulnerable job seekers often face several challenges at the same time. That could be social difficulties, that could be health issues, that could be family responsibilities or psychological barriers, or even public transportation might be a barrier. So these challenges are often interconnected between the systems, if you know what I mean. And public employment services alone cannot always address all of those complex challenges. Let us take as the example, a woman who is living in a rural area having small kids. What if we only suggest a work for her? We only refer her to a work proposal, to the vacancy, without moving the barriers of the transportation from the rural area to the town or to the place where the working place is? What if we are not removing the barrier of the child care? That wouldn't be successful. This is why coordination across institutions is very much important. And the public employment services also often work together with social partners, such as also Melisa mentioned earlier before, social services, healthcare providers, municipalities, non-governmental organizations. And this is very much important in order to provide the comprehensive support for the client, for the job seeker who has complex problems. So each partner contributes with different expertise, with different range of support, which is very much important, which is crucial when we are talking about the case management. So as the example, social services might help with everyday life challenges. Healthcare providers can address healthcare related barriers. Municipalities might address the problem of public transportation as the example, or childcare. Let us take it as a barrier. Non-governmental organizations often have very close contacts with different kinds of vulnerable groups and understand their needs very well. So this is why we need to spread our network in order to come to that person with a different range of services. And without this cooperation, if we may say it like that, individual may struggle to navigate through different systems, as Melisa mentioned earlier, because it's different system in overall, and may not receive the support that the person is actually in a need of. So when institutions work together, coordinate their efforts and support, in that case, the support becomes more effective and better tailored to the individual. So this cooperation is very much important, and also cooperation helps to avoid the duplication of services, because sometimes there might be some situations when the services or when the support duplicate each other, and it's not always very effective. So when we're talking about the holistic approach, when we're talking about the case management, we are talking about the network of social partners with the aim to actually address the complex problems the person may face.
Thank you, Vaida. So case management is not just about services, right? So as you both mentioned, it's about changing attitudes and removing barriers. So Vaida, to start with you and then with Melisa, why is mindset both of the job seeker and the case manager so central to achieving sustainable employment outcomes?
Mm-hmm. When we are talking about the changes, always, like that, I cannot change. I will remain in my, let's say, safe area. So case management is, like you said, from the very beginning, case management is not only about providing services. It's also about creating the change or creating the environment for the person to create the change for the person himself. And the mindset plays a very much important role in this process. Many vulnerable job seekers might experience long-term unemployment, like Melisa mentioned earlier before, one of the barriers. Or sometimes the vulnerable job seekers might face repeated setbacks or disappointments. And this actually affect the confidence and motivation, and let's say person would calmly remain without any change. And person might become passive in the job search, might lose the belief in abilities, might face a situation when the employment outcome is only a short time or very much unsuccessful. So from the very beginning, when we are talking about the case management, we are talking about the empowering the individual to take part in the case management, to take responsibility of his or her own activities. And when the job seeker is actively involved in identifying barriers, quite openly helping the case manager to identify the barriers, setting goals, working together with the solutions, the process become more effective because the person himself or herself will become more motivated and engaged. And positive and proactive mindset helps people to overcome challenges and move forward.
Thank you, Vaida. Melisa?
Yes, I'm just going to build upon what Vaida just stated. The change of thinking is actually in this particular case, when applying case management approach, it's interconnected. It's helping, of course, the job seeker making their steps towards the labor market, finding appropriate positions, and which is very important, retaining the positions. Now, it's not always the case. However, it also supports the caseworker, him or herself. The caseworker, it's actually very transformative for the institution itself. It changes the way of thinking and how the institution approaches problems in the overall system, in the overall, in this particular case, developments in the labor market, because in those cases, having this approach is helping them also realizing the needs of job seekers and thus achieving more successful support with more successful results, and their performance also increases, which then again in turn brings more benefits to the job seekers. It's an interconnected circular process and the system that we are dealing with. So it's very important once there has been this transformative change in the institution, it will influence the job seekers, but then also the other way around. I would say that looking at it from the lens of market system development, it's not only about providing better service, but it's also a way of institutional people working in the institutions to learn how to deal with their own workload with cases, and also how to work with other market actors such as social institutions. We mentioned them already, health institutions, relevant NGOs or NGOs in general. So I think it's very important to realize that this approach brings mutual benefits, not only to the job seekers and of course the public employment services and eventually employers, but also to the overall labor market situation and then economic situation of the job seekers and vulnerable groups.
Thank you, Melisa. So case management is not just about placing someone into a job, right? It's about identifying, removing the barriers that prevent people from participating in the economy, and doing so in a way that strengthens institutions, improves coordination, and builds trust between citizens and the public services. So through this approach, public employment services can move from being administrative bodies to becoming active enablers of inclusive economic participation. Thank you, Melisa, and thank you, Vaida, for being part of this videocast.